Kia ora North to those online. And Pauline, I was just acknowledging your work and stating how it's really good to provide some context to what we're talking about today, including some of the limitations that we have related to this work. So everyone knows that inter-RAI assessments are comprehensive. Many of the different tools have over, hundreds of questions. There's an assessment, but there's also a care planning aspect to interRAI. And what we heard anecdotally was that there was a need for the information that was produced from an interRAI assessment to be communicated better. So we undertook a nationwide survey where we asked people that use interRAI data in their professional practice, as well as older people that had been assessed and their whānau, what they found in terms of the interRAI assessment and the information that was communicated to them after assessment. I presented that last year, so I didn't want to present it again, but the key takeaways were that people felt that there was a need for some sort of summary to be produced after an assessment, and that there was interest in the potential for AI to produce summaries from that. So based on that, we sort of developed a study protocol to investigate the use of AI in generating summaries from an interRAI assessment. So we went to the National AI and Algorithm Expert Advisory Group, or NIAG, who sit within Health NZ, to get advice from them in terms of our study protocol and approach and the technology we'd be using. We then sought ethics approval from HDEC. HDEC said, it's not for us. Go to your local research body. They didn't need to see it, they said. So we got approval from NIAG and the Auckland Health Research Ethics Committee to look at the use of AI summarisation of interRAI assessments. So we were able to access 1,200 de-identified interRAI home care assessments and 1,200 LTCF assessments, and 25% we sampled, so that 25% of those assessments would be from people who identified as Māori. And we used that within a Azure sandboxed environment and thanks to Robbie for de-identifying all that data, because the comments don't always, so although we could remove some identifiable things like NHI name, date of birth, region, what wasn't always identified was the comments, and we really recognise the importance of those comments that interRAI assessors are making in terms of the care planning and the assessment, because otherwise you're left with the sort of the metrics of an interRAI assessment, but not the contextual factors that are provided in those comments. And so we're just using that and some very simple prompting. Using large language models, we developed an initial draft summary. And you're not intended to read all this, but I just wanted to give you an idea of what that first summary looked like. So there was just pointing out some key things. It was talking about ADL hierarchy, long form assessment. And when we look back to that survey, what we found was people that were intermittent users of interRAI. So for example, general practitioners, they're looking at people from, babies right through to older age. They wanted a summary, but might not necessarily understand all the complexities of interRAI scoring and the interpretations of those. So that was sort of the summary that was initially developed. We then sought to do focus groups, and we had 3 different types of focus groups. So some with home care assessors and people that worked in the home care sector, some in the aged residential care sector, and then clinicians that don't work in either of those, so geriatricians in hospitals, general practitioners, and I think there were also nurse practitioners actually from long-term care in the clinicians group. And we didn't ask them about individual people's assessments. We asked them about the content and the type of information that was communicated in the summaries and asked them to provide feedback on that. And so we did 1 round of focus groups. And then from those focus groups, we reviewed the language and inclusion of the scores. They said we can't just have the scores, we need some context around those scores and what that means. The formatting of the summary and the fact that there needed to be some refinement of the care planning. So we refined things a bit. And then we did a second round of focus groups. And then we added in some score interpretation, so the definitions of the different scores and scales, the scales and like the CAPs, the clinical assessment protocols. Forget the new name of what a CAP is. And then from that, we, again, not to read, but you can see that, so general feedback was we want a bit more information, we want it to be more personalised, we want those comments to be included. There needs to be some care planning, there needs to be, you know, some information about what people can do as well as what people can't do, and to make it a bit more personalised. Clinicians, the clinician group were really keen on a reasonably comprehensive summary, but also they identified that there would be real desire to have the summary linked to other data sets as well. So that's sort of, outside the scope of what we were doing, but, but within the capacity when we think about New Zealand's linked data sets. I think I just wanted to point out here, to link it back to Pauline's presentation, is these summaries are only going to be a reflection of the assessment. And so in our, small little project, we weren't although we received critique in our focus groups of the assessment process and the contents of assessment, that wasn't what we sought to do. So we were looking at if you have the assessment completed, what can a summary look like with the support of AI? And so that's another part of the summary, and then the care planning considerations. So that's where we sort of got to after 3 rounds of assessment. 3 rounds of focus group, sorry. And we've just sent out, we had a working group. So thank you to all those that have touched this project in all different ways, because I know a number of you in the room have. We released the draft report from this work back to that working group that has 25 to 30 members from across New Zealand that are involved in the sector. And then we plan to provide that to Health NZ, because it provides some recommendations on things that could be taken up by different players and different actors in this sector. I do just want to briefly mention some work that's continued on from this. So I think part of the knowledge exchange is it's important to recognise all the different people that you work with in this space. So I've worked with so many different people to get things to this stage, and we now have a grant that's led by Professor Hamish Jameson, which is an MB grant in partnership with Singapore Management University, as well as 3 universities in New Zealand and other collaborators from within the health sector. And so we were positioned to be able to support with a small part of that based on this initial groundwork. And so we really, the survey I talked to, we didn't set out a survey saying, what do people think of AI summarisations of interRAI assessments? We were thinking, people say they would like better information communicated to them after an assessment. What does this look like? And so it sort of was a ground up approach to where we've ended up. And in that, we're aiming to test the feasibility and acceptability of AI generated summaries. I'm really keen to get people's feedback on this. I'll be around all day and here tomorrow for the researcher only day. So feel free to get in contact, because as I say, collaboration is really important in this. We want to be able to think about what this looks like in the real world. And when I say we're testing the feasibility and acceptability, we're not saying that this is going to be implemented. We are genuinely interested in what people think of this approach in the summaries. What we intend to do is a similar process to what we did with clinicians in our the earlier part of this presentation. So produce some summaries, understand from focus groups the type of information and the way that information is communicated to get an idea of what people want, and we have ethics in place for that. And then we're planning on doing more of an intervention study where we would recruit participants who have had an assessment and assessors that have done assessments to think about to ask them what they think about and that AI generated summary for that individual person. We want to understand the amount of changes that would be needed, whether there's any incorrect information that is generated from this. And we're also, with the support of Masters and PhD students, understanding and exploring, and also with the Māori and Pacific advisory groups on the broader project, understanding the, how we manage bias, how we, the factors that we need to consider when developing this and implementing. What we would also like to do is to provide Health NZ with an idea of the architecture and the implementation framework for this, for it to work in the real world. And so again, we'll be going back to NIAG, interRAI Services, Health NZ to understand, what tech stacks they're using and ensure that there's alignment. We are already engaged in that space, so they're thinking about the sustainability of approaches in this space as well. So please get in touch if you are interested in being part of the working group or have ideas that you want to share. And that's just some of our research team from the earlier survey that we did. Thank you.
Kia ora, I'm Amy, a needs assessor, and really interested in this area of care planning and what we might send back to our clients or patients, and also then to meet the needs that might be of the client and also other health professionals that are involved in their care. Just a question around that further work you're doing, is that going to be national sort of work? The first part I got that you've done that first part in Auckland, and then possibly is it going to go wide?
So the first part wasn't just in Auckland, so it was the majority of focus groups were online, so we could have contributions from all over the country, but there were probably the majority were from Auckland because, no, we're looking for a needs assessment team that would like to be involved. So, feel free to reach out, open to suggestions. So we understand that this will take working together, that there'll be, a workload demand if, you're involved in this. So we do want to make sure that people, have the opportunity to feed in, because that's all important in the feasibility of it as well.
Was there much difference in what was already being provided nationwide out of different areas?
The feedback you mean from the different focus groups? Or what summaries have already created? Well, in terms of the survey, we didn't, because we weren't focused on that in the survey, what we did find was that around 50% of people said that they got good information from it, but a similar amount, and some of those people who said they got good information said that they'd like better information, and so around 50 to 60% of people did say they wanted better information communicated after assessment.